we're just going to wait a few minutes before we get started. Hello to everyone here on Zoom. Hello to everyone out there on Facebook Live or watching this recording afterwards. It is, as always, amazing to have you all with us. And let's see, it's about 7:04, so it looks like we have everyone in the Zoom room. So we will get started. Just to kick us off, I just want to go over some platform protocols. So as a reminder, we are using Zoom. And so if you would like to participate, if you have a question, we love our audience to participate. We love to hear from the community. So please, if you have a question while we're discussing some of our topics, put them in the chat box. You'll see a little bubble down at the bottom of your screen. It's a little speech bubble. Click on that, and that's how you can access the chat. And if you would like to speak, then you can raise your hand. It's underneath the reaction button, which is a little smiley face at the bottom of your screen with a plus next to it. So raise your hand, and our team will be on the lookout. We'll call on you and make sure you unmute. But if you're not asking a question or speaking, please make sure that you're muted so that we don't have any feedback issues. So without further ado, I'd like to hand it over to Michael Briscoe to do the introduction from our host. Michael, go right ahead.
Good evening. Thank you, everyone, for joining. My name is Michael Briscoe. I'm a double agent. I'm here as part of the host organization, Omega Psi Phi fraternity, and I'm also a member of the URU team as a team coordinator. Without further ado, I'd like to introduce two of our speakers tonight, panelists, Dr. Jedan Phillips and Dr. Dionne Hart. Dr. Jedan Phillips received his MD medical degree from the University of Maryland and his bachelor's degree from Johns Hopkins University. He is an associate professor of family population and preventive medicine at the Renaissance School of Medicine and has been faculty member since 2005. Dr. Phillips holds both clinical and educational positions at Stony Brook Medicine and is community advocate for preventive and primary medical care services for the underserved living in Long Island communities. In addition, he has also served on the school's admission committee, worked as a faculty advisor for Stony Brook, for the Stony Brook chapter, the Student National Medical Association, and the director of Stony Brook Home, a student-run outreach clinic. He has won numerous awards, including the Global or Gold Humanism Award for modeling the very best qualities of a compassionate physician, induction into the Medical Honor Society, Alpha Omega Alpha, the Michael Maffetone, did I pronounce that right, Dr. Phillips? Maffetone? Service Award.
Yes, you did. Yes, you did.
Of the Jedan Phillips.
Now you just got to get Jedan right.
You got it. Jedan, there you go, in honor of his service. In 2020, he was named the Associate Dean for Minority Student Affairs, where he plays an integral role in helping students achieve their career goals. His goal has been to support and promote the health and well-being of all students in the Renaissance School of Medicine with encouragement and support to achieve remarkable milestones and continue to foster this at many levels during their medical school journey. Dr. Jedan Phillips. Dr. Dionne Hart. Dr. Dionne Hart is board certified psychiatry and addiction medicine. She is an adjunct assistant professor of psychiatry at the Mayo Clinic. In 2014, Dr. Hart was named Minnesota Psychiatrist of the Year. In 2017, Dr. Hart received the National Alliance of Mental Illness Exemplary Psychiatrist Award. Dr. Hart was the inaugural chair of the AMA's, American Medical Association's Minority Affairs section. Dr. Hart is currently an alternate delegate for the AP.
Michael, you're muted.
Where did I leave off? I did not mute myself.
Speaking of the AMA.
Okay. Um, she was Dr. Hart was the inaugural chair of the AMA Minority Affairs section. Dr. Hart is currently an alternate delegate for the APA to the AMA and president of the Minnesota Association of African American Physicians. In 2020, Minnesota Physicians Journal named her one of the 100 most influential healthcare leaders in Minnesota. Dr. Dionne Hart.
Thank you. Thank you so much, Michael. We are so excited to have these wonderful guests with us. Before we get started, I would also like to thank our entire team. As Michael said, he is part of our team. He's one of our coordinators. So thank you so much, Michael, for all the work that you do and for those wonderful intros. Thank you to Meredith for helping set all of this up. Thank you to Andres. Thank you to Molly and Ruth, our tech people, for this evening. We're very excited for this town hall, and we are very excited for the active participation that we're going to have tonight, because we have a great conversation in store for all of you. Before we get started, we're going to launch our first poll. Just as a reminder, these polls are just for our information. It's to help us to respond better to community needs and to understand what we need to do to serve our community better. So if everyone could take just a couple of minutes to fill out this first poll, and then we will do our customary warm up to ground us in the moment, and we will get started. All right, if you could submit your answers, we'll close the poll in just a few minutes. And so, like we usually do, we are going to start this town hall off with our warm up. We work with our lovely colleague, Abel, who is over at Revamp Fit. And Abel, I will hand it off to you for my favorite part of the week, our movement.
All right. Well, thank you, Carmen. How is everybody doing? I hope everybody's been well. I'm excited to be here with you guys today. Again, my job with you guys is to get a few minutes to move and loosen up the body, whether you've been, at work or standing. This is just to get your body flowing so that you guys can have a great time with the town hall meeting. So before we get started, I'm going to go ahead and play some music that will just kind of, get our energy up. So I'm going to get that set up. So I think it should be good to go. All right, guys. So like I said, this is going to be for a few minutes, and I'm going to show you guys how to do this in a standing position and also seated. So you don't even have to get up if you don't want to. We're going to climb up. So we're going to start with the ankles, and my goal is to loosen up every single major joint group, okay? So first thing up, we're going to practice doing our ankles. We're just going to go on our calves like this, and then fall back and pick our toes up. So I'm going to show you the standing one first, and I'll show you how to do the seated, okay? So from a different angle, just getting up on our toes and then picking up our toes, all right? So like I said, seated version is the same exact thing. Just going up on our toes and then picking up the toes. Going up on our tippy toes and picking up our toes, all right? And this is just to get the calves, moving and getting blood flow so that it can warm up your ankles and knees. All right, and every single thing that I'm gonna be doing will be for 10 seconds. So we'll start counting for 10, 9, 8, 7, 6, 5, 4, 3, 2, and that is time. Good job, you guys. All right, our next one is to target the hamstrings and the back of the knees, okay? It's a good warm-up to do after being in this flex position, okay? So we're gonna kick both legs forward like this as much as we want. And you might have to scoot to the edge of your chair. All right, just don't fall off the chair while you're doing this. So legs straight forward, and we're gonna squeeze our shoulder blades together, and we're just gonna bend from the waist. We're gonna hinge and bend from the waist, and then get right back up. All right, and you should feel a lot of this in the hamstrings. bend without slouching, and back up, just like that. All right, and this is a great stretch for the hamstrings. And it's the same thing. If you're doing it standing up, just bending down and coming back up. Hinging and bending down, coming back up. I'll do this one seated as well. All right, and after we do a certain amount of reps, we're gonna hold it at the bottom for a few seconds, all right? So we'll do a couple of more reps. All right. All right, now we're gonna hold the next one down for 10 seconds. We're gonna go here, hold it there for 10, 9, 8, 7, 6, 5, 4. All right, good job, you guys. Okay, so now we're gonna climb up. So we're gonna loosen up our lower back and our torso area, okay? So if we're doing this seated, we're gonna practice having two hands, and we're gonna twist, and we're gonna, if you have an armrest, you're gonna grab it, and you're gonna look back, right? You might hear some cracking, which is okay. Two hands again, and you're gonna turn back for a second, and repeat. Twist, and turn back. All right, if you wanna do a double, right, you can twist, and you can drop your knee inward like that, right? Just to get the inner groin warmed up. So again, twist, look back, and you're there, okay? If you're doing the standing, same exact thing, but will be more arms involved, okay? So just swinging your arms and just loosening it up, all right? So either of them work. We'll do it for 10 more seconds. So we'll go for 10, 9, 8, 7, 6, 5, 4, 3. All right, love it, guys. Okay, now we're gonna get the sides warmed up. Another area that's usually tight for most people. I'll show you guys how to do it. Seated first, we're gonna do a side bend and a half. We're gonna rest one arm here. We're gonna do side bend and then do a half rep right after that. Hold it for a second, right? Side bend, and then bend again, all right? Side bend, and then go in again, right? You should feel a nice stretch on your sides, right? Don't overstretch, just go and listen to your body. Same exact thing if you're doing a standing, of course. And all these movements can be done at any point of the day. You can't overdo this, right? This is just to get blood flow. Okay, so we'll go for 10, 9, 8, 7, 6, 5, 4, 3, 2. All right, love it, guys. Okay, now we're gonna climb even higher. We're gonna practice, our next exercise will be for our shoulders and our chest muscles, okay? So we're gonna practice doing some shrugs. We're gonna have our hands here. We're gonna practice doing backward shrugs. Keep your neck still. Don't, move it back and forth. We're just going up and then bringing them back. If you wanna target it a little bit more, you can have your elbows out wider. Same thing again if you're doing it seated, guys, okay? All right, how about we go forward? Let's go forward with it. Just like this, a few more seconds. We'll go for another 5, 4, 3, 2, and that is time. All right, guys. Now, our next one is more of a stretch, right? To stretch the neck and shoulder area, okay? So this is what we're gonna do. We're gonna drop one hand straight down, right? Down lower, right? If you wanna feel more, you can even do your palms out. And you're gonna pick your other shoulder up, and you're gonna just kind of bend away from this side, okay? And you're gonna feel a nice stretch on your shoulders and traps, okay? If you're doing it seated, you can even hold on to your chair and lean away so you can really feel that neck area. And we're just gonna hold this for 10 seconds. So we'll go for 10, 9, 8, 7, 6, 5, 4, 3, 2. All right, good job, guys. Okay, now we're gonna do the other side. So we're just dropping shoulder down to press the shoulder. We're gonna pick the other shoulder up just so you can rest your head, and you're bending away from the shoulder that's dropped. And you can hold on to something if you need to, or you can have your palms out. Either works, and we'll do it for a few more seconds. So we'll go for another 5, 4, 3, 2. All right, guys, I have one more for you guys. we're gonna practice doing some head rolls, okay? So do this very, very slowly. Start off by just doing small circles, just rotating your head, all right? And again, you don't have to, if you wanna just stick to one of the exercises that felt really good, you can continue doing that. If you wanna gradually build up to a bigger circle, you can. If you feel a tight spot, hold it for a second. All right, let's go the opposite way. All right, guys, we'll count for 5 more seconds. 4, 3, 2. All right, guys, there you have it. Well, thank you guys so much for having me. Again, my name is Abel with Revamp Fit. We offer personal training and group classes and other things too. So thank you guys so much for your time. I'll be seeing you guys next time. All right. Have a great town hall meeting.
Thank you so much, Abel.
Thank you, Carmen. I'll turn off the music.
No worries. All right. Well, now that we have been grounded in the moment with some movement, we are going to move into the town hall portion of this town hall. So, welcome again, everyone. We are very excited to have Dr. Phillips and Dr. Hart here with us this evening. And we are going to kick off our conversation talking about Black men's health. So, starting off, one thing that we've been talking about a lot, especially here at URU, is the idea that we're going through a number of pandemics at the moment, and just one of them really is COVID-19. The other has been pervasive and around for much longer, and that is racism. And so we know that racism impacts our health, our mental health in a lot of different ways. And one thing that I think is discussed in academic realms, but not always talked about, sort of person to person in the same way, is the way that like overt racism and covert racism impacts our health. So, Dr. Hart and Dr. Phillips, what are some things that you can talk to us about, like what is overt versus covert racism, and how does that impact either physical or mental health, whichever you would like to address. Dr. Hart?
Thank you for the question. If you think about racism as a stressor, racism going to impact every part of your health. So whether it's somebody overtly saying something to you that is discriminatory, or a microaggression where you kind of walk away, you don't quite know, but then you have this feeling, or it is clear that it was a microaggression. All those things add up to increase your stress level. So if your stress level increases, and you're also at risk for infections, inflammatory diseases, chronic things like hypertension, diabetes, all those things can be related to stress. But you can also think of it as, even with the COVID-19 pandemic, we as physicians said, hey, maintain social distancing, try to avoid work, stay at home, do these things. Most people who are minorities are unable to do all those things. Can't stockpile your medications. You may not be able to stockpile your groceries. You may have to use public transportation. You may be an essential worker. And for a moment they were heroes. So all those things you couldn't do easily, even to maintain your health during the pandemic. So you think about all those things, those are related to disparities. We call them social determinants of health, but they are related to racist policies that were enacted, and we are still trying to undo them. So, and I think we have a responsibility as physicians to be aware of that. But also when you're with your doctor and they say, okay, well, you probably should go for a walk after dinner. Well, I say sometimes that's not a safe thing to do, or you don't have a space where you can't. So remind them that, this ideal situation is not everybody's reality, and really start to like push back and ask questions when you're set up for failure in some ways. When they give you this list of things or these medications, get this, there's a $30-$40 copay and you just can't do it. Say, is there another option? And you have the right to say that. Doesn't make you a bad patient. You are advocating for yourself. And last thing I would say about racism is who's in the room with you. So Dr. Phillips and I are one of 4% of Black physicians practicing in US. We are 2 of 9% of minority physicians of any underserved community. That is not by accident. That is because of policies that were enacted. So racism impacts every aspect of healthcare.
Thank you so much for that thoughtful response. And it's very, very true. I think one thing that I study, you're talking about the impacts of stress and how it builds up over time, and that's something that I've studied in my research. And it is quite concerning, just how much more at risk people become when you can't decompress, when you don't have the space to deal with that stress, and you end up with this toxic buildup of it in your body. Dr. Phillips, is there anything that you would like to add, thinking about overt or covert racism, and maybe how or where we see racism emerge in medicine or the medical field?
Oh, I think, Dr. Hart gave an incredible answer that really touches on the intersectionality of this moment. Again, we have been the low-hanging fruit with respect to our vulnerability when it comes to COVID. Racism has played a role in that. In addition to that, racism has also, as Dr. Hart mentioned, played a role in some of the health metrics that negatively impact us. People like in my family, my grandparents had diabetes, my parents had diabetes, or sugar rather, and my great-grandparents had sugar. So again, we lived in certain inner city communities. A lot of times we also don't have, as Dr. Hart mentioned, quality access to food. We have food insecurity. So again, as it was said, we are in the got-to population. And because we are in the got-to population, we unfortunately, with our health risk, with our travels, with the multi-generational household that we may have, all of these circumstances create, us being that low-hanging fruit. But I think the other thing you saw, I'm in New York, and we were locked down in the spring of last year. And one of the things that you saw, my community, I grew up in East Elmhurst, Queens, New York, and we were labeled the epicenter of the world. I've lived in my community, my family over 60 years. Every day, somebody was getting sick with COVID. And again, we are one of a small population of doctors. I didn't come from a family where there were doctors in my family. I didn't come from a community where I knew more cats that sold drugs and played ball than people I knew that went to college and went to medical school. So becoming a doctor, I had a responsibility. As W.E.B. Du Bois talks about being that talented 10th, that's how I was. And that's, again, unfortunate in the sense because with that, you've got a lot of people that trust you. And with this pandemic, after I would get off of work, working in the hospital, in my office, again, I had virtual rounds is what I called them. And those were people in my community where people every day were getting infected with COVID. And unfortunately, we were operating on misinformation. And misinformation can explode when you have a level of mistrust. And unfortunately, the medical community has not always presented itself historically. Yes, we can talk about, Tuskegee and other things, but sometimes it's much more basic to the point of when I went to the doctor's office, the person at the receptionist desk was rude to me. The doctor didn't look at me. All of these things play a role. And then when you have this misinformation, you got people telling you, well, you're not sick enough to be in the hospital. You need to just go home. They don't tell them that they need to wear a mask. They don't tell them how to, in that limited space they may live in, how to, as safe as you can be safe. So these things lead to this pandemic exploding in our communities. And it's more of a concern now because as we open back up, who are the people that are working in all of these spots? Who works at the restaurants? Who works at the hotels? Who cleans the rooms in the ER in the hospital? Again, they're people that look like us. So once again, because of our position, we the pawns on the chessboard in America. And the pawn in a chess game, you can afford to lose those pieces. So as doctors, I found this has been my Super Bowl as a doctor. In New York, being a person that was here during 9/11 and seeing the heroic job that our law enforcement and firemen did in that day, in that moment. That was their Super Bowl. Right now, especially as a doctor of color, Dr. Hart and I could be doing much other things right now, but this is very important because as we know, and since I'm not wearing my colors, but again, being the initiated, a line of pledgees are only as strong as their weakest link. And if our weakest link in America is our communities of color, then we've got to make sure that we change that because we may have another pandemic. And again, that's why this conversation tonight is important because we've got to recognize that there's so many other pieces that need to be looked at. Yes, we need to look at the immediate. What do we need to do? Wear a mask, get a vaccine if you choose to. But how do we improve those circumstances that made us the low-hanging fruit? Because again, now that we look at vaccinations, how come communities of color, and I'm on the New York State Board of Vaccine Distribution Equity, and we were seeing white communities had vaccine pop-ups or vaccine capabilities. And again, it was because they had adequate facility in their communities. We don't have that. And the excuse was, well, you guys don't have the space to entertain it. But again, under all of this, we got social justice. And January 6th, even though it don't have anything to do with the vaccine or the pandemic, other than the risk people took going to the Capitol, that made me more passionate about talking about this because I knew that folks that come from where I come from would see, damn, you see these folks just went down to the Capitol, and if all of us rolled down there like that, it would be a problem. But they didn't have a problem, and now they want me to take these people vaccine. Again, that is how the conversation can go. So that's why taking this opportunity to talk about it, it's critical because, again, when you're in a relationship, you can't just insult, offend, make someone upset and think you can just move on. And unfortunately, just because we got this moment of the pandemic, the mistreatment, the George Floyds, all of these circumstances that reveal double standard in America, unfortunately, these things, even though they may not be scientific, can contribute to vaccine hesitancy, can contribute to the spread of misinformation, even amongst our educated people, because it ain't just individuals that don't have a degree that are saying, I'm not messing with the vaccine. I know doctors, I know nurses, I know other people with, higher level degrees of color that are not trusting. And they're not trusting the legacy of how we've been treated. So, again, as Dr. Hart said, we have been you couldn't get to this point in our careers if you haven't been able to navigate racism, microaggressions, systemic inequalities. And I think it's incumbent upon us right now to really make sure, because how crucial it is to the conversation of getting past COVID, that we make sure that it's included and in the forefront.
I completely agree. Thank you so much for your response, Dr. Phillips. So one thing that we typically do in our town halls is to go through a COVID-19 update, which I think this town hall in particular is going to be really important because of all of the things that have been happening. COVID from the get-go has been this evolving situation, and it's been really hectic. It can be very difficult to follow, especially when so much is happening all at once. So one thing that we've been looking at, I believe Dr. Phillips, you mentioned how things are starting to open back up now. And it's really interesting how, things are opening up, but we still have some pretty high numbers, and the vaccine isn't out in all of the places where it needs to be. So would Dr. Hart and Dr. Phillips, would you be able to give us a brief COVID-19 update? What are the infection rates looking like? are there specific impacts of COVID-19 on specific populations? So we know that minority populations have been disproportionately impacted, but even within that subset, what are some of the patterns that that physicians have seen?
The patterns in the COVID situation is if you're vulnerable and you're exposed to COVID, unfortunately, it can get you. If you can't just start doing wellness and you've got a history of diabetes and think that COVID is going to help me because I've been on a immuno boosting. As I mentioned, and as Dr. Hart mentioned earlier, the social and health metrics that affect us as people of color have really made us the low-hanging fruit. And unfortunately, as we've seen, we're up to almost 580,000 people that have died. 44% of them are people of color. And we only make up 11% of the population. So again, that speaks to the weight that COVID has had. We have gone down nationally to about 70,000 cases a day, which again is an improvement, but still not improved enough. And unfortunately, it puts us in a space, and I think all of us, we need to look at countries like Brazil. We need to look at countries like India, where COVID is popping right now, y'all. COVID is real. And in India, there are over 500,000 new cases a day, potentially. And the reason being is that, as Dr. Hart knows very well, being a mental health specialist, this thing has had an incredible weight on everybody. And with the weather getting better, and we've gotten some positive information with respect to the improvements that we've seen with people getting vaccinated, but unfortunately, it has created a false sense of security. Because I feel with that, people don't understand what it means to be vaccinated. What it means to be vaccinated is I am fully vaccinated. I had the Pfizer vaccine. And if I'm in a small group of people that have all been vaccinated, we can take our mask off. However, if I'm in a group and one or two of the people have not been vaccinated, me not having a mask on doesn't necessarily prevent me from getting infected. So a person that's been vaccinated can still be infected by COVID. The vaccines, whether it's the Moderna and Pfizer or the J&J, prevent serious illness and prevent death. And that's one of the reasons is those were the biggest things that were affecting us. However, I'm seeing a lot of people, especially in our communities, that think because I'm vaccinated, I'm all good. Like the movie Old School, where Will Ferrell said when he got drunk, he became Hank the Tank. That's what people are doing with respect to, I got my vaccine. They're doing the most. And unfortunately, in these rooms where you don't know who's vaccinated and who's not, what can happen, and what we're seeing is that even though we're seeing less in the older population as far as less mortality and morbidity, the newer groups where you're seeing a rise in cases are your younger people, people between the ages 18 to 50. Those people are now the higher vulnerable group. They're making up a higher number of the cases. They're making up a higher number of the hospitalizations. And one of the other pieces that are coming out now that we're more knowledgeable about now than we've ever been is these long hauler symptoms. So again, we're seeing more people that have had serious COVID get long hauler symptoms. And unfortunately, you're seeing more women get long haul symptoms than men. And a third of the long haul symptoms can be neurologic, like a headache or numbness. And it could also be psychiatric, like anxiety or depression. And unfortunately, with these long haul symptoms, I'm seeing people that are young, college cheerleader, professional athlete, they come back from COVID, they can't even walk down the block. So even though that may not be the normal, that is still a possibility. Another thing with our young people is you're seeing that the young people with these newer variants, which are highly more infectious, these variants create a situation that with the young people being around each other, they can spread it. And they may not get sick, but they can give it to their moms. They can give it to their grandparent, father. They can give it to that person that takes care of them, that helps them make decisions in their life. And unfortunately, it also keeps us from having some normalcy. So with that being said, as the vaccines are out, what we've seen is that the Moderna and Pfizer, which are the messenger RNA vaccines, were available, and we saw some improvement. And then Subsequently, we had the Johnson and Johnson, and everybody wants to hear about the Johnson and Johnson because we had a recall, or not a recall, but a delay or hold on the vaccinations with it. And it was because they found 6 women between the ages of 18 and 50 that had some clotting situations associated possibly with the vaccine. That would be 6 cases out of 7 million, which is not high enough in other areas of medical research where they would stop. But because of the sensitive nature of what we're going through right now and how people are hyper vigilant, maybe even over the top as far as how they interpret different things with the vaccine, they stopped it. They pulled all the cases. They checked it to make sure there was a problem or not. And they've reopened or started the vaccination process with the J&J, and they have some highlight or box warnings with it. So again, right now we have 3 vaccines available. As far as us getting better as a country, we're about 70,000 cases a day, but we're in danger of having another rise because with the weather getting better, you're seeing more people out. Unfortunately, the other thing that you're seeing is everybody's not following. They're wearing their mask like it's stylish. You got to wear the mask over the nose, because if you're not wearing the mask over your nose, take the joint off, because you're not really protecting yourself or anybody else if you don't wear it correctly. You know, the other thing that we're seeing is because of this historical racism and other related issues, there's a hesitancy in our community. And we're seeing, as far as people of color that are willing to be vaccinated, we're lagging behind in the numbers of people that are vaccinated. And part of the reason is our apprehension about the vaccine, misinformation, and again, social justice and racism. So right now, you know, I know as far as Omega Psi Phi, our COVID task force, we're doing things, going on college campuses, talking to young people, partnering with our local churches and other entities that might have young people that are part of it, to talk to them. Because the thing I was noticing, like as we rolled the vaccine out to the 65 and older population and talk to them about the myths versus the facts and the myths versus the fear, when it came down to the vaccine, young people got the same concerns and questions. So it's incumbent upon us, because what this pandemic, and Dr. Hart, I'm sure, could attest, it has exposed the emotional vulnerability of our children. And again, a lot of times, because we that got to population, we tough it through no matter what. But this is not the regular situation. And our young people, that young child that you had that may have went to college or that may have been that doctor, this is a moment where all of that could change. So again, it's incumbent upon us to not, everybody's not going to be Dr. Hart or Dr. Phillips, but you can be a COVID ambassador. So again, we've got to be more involved in leaning into our vulnerable folk, because part of getting the vaccine to people, some people don't have computers, some people don't have reliable internet, some people don't have transportation to get to the vaccine site. We got to bring the vaccine to the folk. And part of that is not going to happen unless we, the people on this call, get involved. But again, you know, I yield my time to Dr. Hart, you know, so she can add on.
I mean, there was so many good points there. So I would kind of think about it as like these numbers. 3 million people have died from COVID worldwide. So like my hometown in Chicago, it's like Chicago disappeared. Think about it like that. In the US, 577,000 people have died. Minneapolis, gone. Half of St. Paul, gone. Like, think about it. These are devastating numbers, and still people do not take it seriously. And would you have to assume, just like when we were talking about HIV, assume everybody around you has it. You can't look at people because they may not even know. They may be asymptomatic and not know that they have the infection. So they're not trying to like trick you. They just don't know. So assume everybody has it and take precaution. Take your distance, wear a mask, as Dr. Phillips said. But also, when you think about vaccine hesitancy, one of my colleagues says vaccine deliberation, like people still trying to figure out. Because if you keep giving the image and hearing that Black people aren't taking it, then some people are going to be like, well, I wonder why, what's going on? You know, they're going to start to think more negatively in some cases because that's the media message. But in the beginning, when you see people like you see drive-throughs where people lined up, what if you don't have a car? How you gonna get in a drive-through line without a car? You're gonna get on transportation, public transportation, and then stand in the middle of a line? Like that does not work. So some of the issue wasn't that we just weren't coming, we couldn't participate,
It was an
right?
access issue. Yeah.
Right. So it wasn't an access issue. So that's why like the mobile units and other things like the mass sites with like auditoriums are so important because everybody can't get in a drive-through line. And when you think about the lockdown, like, you know, I'm like 100 miles from Minneapolis. So there were so many crises going on in this community. It was very difficult, right? But think about it. You weren't supposed to go out. Gyms were closed. You know, I'm like a $5 Tuesday movie night girl. So like entertainment shut down, no concerts, no sports. So all the things that we tell you are healthy coping things gone, just disappeared. And if you were somebody who was in recovery, there were no more AA meetings, and maybe you could do it virtual, but it's not the same, or you didn't have the technology, like those things, like people, a lot of people were not sitting around doing, you know, acquiring a new hobby or baking for their friends, right? So they experienced the lockdowns very different than other people. They were trying to figure out, how am I going to get some type of device so my kid could go to school, right? So we experienced it very differently. So all the positive things that people were using to cope with life, with the stress of doing all these things while Black, were gone, right? So people who were more vulnerable are experiencing depression, anxiety. People who had never experienced any of these symptoms were now having clinical depression and anxiety. And even in the hospitals, and there were groups were very different. People were on iPads in their rooms. So everything about mental health treatment changed. So, and at the same time, doctors were also getting sick, nurses also getting sick. So there's a shortage of providers. So some units were closing. So I mean, all of these things really impacted mental health, and we've had in the United States a record number of people who overdosed because the drug dealers did not get a memo that they were on lockdown. They were still manufacturing, they were delivering whatever they had to do. They gave people access. So all of these things have skyrocketed because if you don't have the positive things available, and you're going to go to the what is available, because liquor stores, as we know, did not close. So there's a rapid increase in another number of people who are now struggling with alcohol use disorders or relapse. So like you said, there are multiple pandemics going on right now: social justice, COVID-19, and mental health.
Most certainly. And one of the questions that came up in the chat that I think relates back to all three of those things, Dr. Hart, and a lot on the theme that we were discussing tonight broadly. Someone asked, how can Black men and their families advocate for their health when there may be few answers because there's a lot of things that are unknown or unavailable, like you were talking about? You know, we were living in this world where, you know, people in our community are already struggling with different things. And then COVID kind of just throws a wrench, you know, in everything. We're already struggling with social justice. We're already struggling with lack of access to just basic things. And so what do we do, you know, and how can we act together as a family, as a community, to lift each other up and to try to make it through, you know, this really difficult time? Because like you said, people who have never maybe experienced anxiety or depression before are now experiencing it at a clinical level, which can be very scary, especially when traditionally in certain households, you know, it's not something that we maybe openly talk about, you know, as much as we should. um
Yeah,
so do you have any recommendations, Dr. Hart, and then Dr. Phillips, I'll pass it off to you after.
sorry, excuse me. So I will just say, like, I am so excited that people are talking about it. So just the fact that you even asked the question just makes me excited, because mental health is health, right? You cannot have one without the other. You can't have mental health and physical health one without the other. They are connected, right? So we need to start treating brain disorders as an essential part of our healthcare. So we have separated things so much, but they are not separate, they are integrated. So just asking somebody about how they're doing and then recommending that they get therapy or that they talk to somebody or just checking in, huge. Just asking the question and normalizing the fact that they may need to seek help. Because I don't know anybody who stayed at home and just said, you know, it's okay. I'm just gonna like take care of my diabetes just by sitting here. It's just gonna magically go. It doesn't happen. And depression, other things are just as life threatening, and they don't just go away. You have to address it. And you know, one of the things we talked about, there's a shortage of Black physicians. There's 2% of psychiatrists are Black. So sometimes it's difficult for people to relate to people who don't look like them, or we call race concordance. But there are many people who may not look like you, but are willing to listen to you and learn and not assume. So don't, you know, don't say, I'm not going to go to anyone who's not Black, because that will cut you off. Go to somebody who is an ally. But first, you got to be willing to do that. So I'm so glad you asked the question, because we all, like Dr. Phillips said, we need to be ambassadors for health, for Black health. We say Black lives matter, Black health matters. And we have to make sure that we tell everybody that we know who we see are who's struggling with any type of health issue, where it's mental health or physical health problem, that there are resources and that you are willing to help them through their journey. And I'll let Dr. Phillips go from there.
Well, again, you know, I think, you know, some other important things you just mentioned, misinformation. You know, people on here, you have a responsibility now to direct your folk when you hear them say something that's not correct to a reliable information source. Dr. Facebook or Dr. YouTube is not acceptable. And unfortunately, you know, again, I don't want to hear the excuse of I don't understand technology, because people do the TikTok, Instagram, Facebook, and you know, and it's easier to look up information than to do some of those postings. So again, we can't stick around with those excuses, because as I mentioned earlier, we are only going to rise as high as our most vulnerable do. And if our most vulnerable do not, then this is not going to go away from us. So again, we've got to address that misinformation. You know, if you sit here, you educating yourself. So let's direct people to the right resources. In addition to that, you know, we've got to, you know, what I found now, just friends hanging out or being in conversations, is if you're not vaccinated, there's shade that comes with that now. You know, and unfortunately, that's not what this is about. You know, everybody, if you make the decision, I chose to be vaccinated because, as I said, I saw what was happening. And I got a group of people in my village that trust me. I got a group of at least 1,000 Qs that if Dr. Phillips don't get the shot, they're not getting the shot either. And again, when I first heard about the vaccine last year, I was like, man, I ain't messing with it. Because my hospital asked me to participate in research in our community. I was like, y'all don't do it right. I'm not messing with that. But as Dr. Phillips, I have a bigger responsibility than to have a basic answer like that. So I educated myself about it. And then I put myself in a position. I've talked at barbershops, in the Zoom platform, because you've got to go to where the people are at. The other thing you got to do is you've got to use language that is not intimidating. As I mentioned earlier, just with the terminology of diabetes, I have diabetes through the family. Unfortunately, I don't have it. But again, if I told my family it was diabetes, they look at what you're talking about. If I said sugar, they know what you're talking about. And unfortunately, as we throw out some of this terminology, you know, again, me saying messenger RNA making antibodies for the spike protein, what does that mean? You know, so the messaging has to be in a language that is received by the people. I think the other thing, again, is you've got to find partners in the community that can get the message out to you. Again, I'm not working, I don't live in New Haven, but URU is, and we're partnering together to get the message from Minnesota and Long Island, New York to New Haven. And that's what we got to do. We've got to make sure we connect with people in the hood, because if you're not grounded in the hood, we're not listening to anything that you got to say. You know, so again, you've got to take advantage of being that person. If they see you, Carmen, they say, hey, Carmen, what up? That's not just a hello. That's you actually having the cachet to be someone that could say, no, that's not right information. You should go check this out at the CDC, or this is what I read at the CDC website, and this is what actually is the case. You know, as Dr. Hart mentioned, and this is my last point, one of the reasons that we are the low-hanging fruit is because we live in a reactionary sense. You know, we don't take the preventive steps to stay on top of our health, our mental health. And I think what the pandemic has revealed, that if you ain't on top of your stuff, it's going to be exposed. And it's really incumbent, again, to get that walking out. You may not lose 30 pounds in a week, but over time, by the next pandemic, if there ever is one, you are not going to have obesity be the fact that you may be vulnerable to getting sick. You know, there were a lot of good people that I know that had diabetes, that had obesity, that had asthma, that were less than 60 years old that died from COVID. You know, so it wasn't all old people and again at the end of life. And unfortunately, some of those circumstances that put us in that vulnerability is because, as Dr. Hart and I've said earlier, we in the got-tos. And a lot of times got-tos prevent you from doing the intentional things to take preventive care of yourself. So again, I think as we look at what do we need to do for the next phase, part of that intentionality in being healthy. And again, it's difficult sometimes in the pursuit of health because you see stuff online, you see these images. Don't be, you know, deterred by the image. Everybody's not going to eat and juice all vegan stuff. Everybody's not going to have an 8-pack and run 10 miles a day or be on the Peloton. It's just as good to walk around the block 3-4 times, you know? And the other thing that you do with it is you walk with somebody you care about, you get a time to spend some time talking outside of the house. Because as she said, the other thing that we're seeing is we had on our COVID task force, we had law enforcement present one day, and they talked about how there's a rise of domestic situations that they have to address during this pandemic. Just one example. So, and we've seen people that are in mental and psychiatric distress in the world get handled by law enforcement. You know, and again, it didn't have to happen. And I'm not saying it's that individual's fault, but again, if we're talking about what the community needs to do, that individual that may be that special person that had a problem, we got to care about all of us. Because again, if we don't take care of the weakest, we're not going to get out of this situation.
Agreed. Thank you so much, both of you, for the very thoughtful responses. We are getting close to time, but we have one more question that I think is really important to address before we go. So someone asked in the chat, how can we climb out of the fear of the J&J pause? And what can be the message that we give to folks who are more afraid now than they were before? I think that this is something we should definitely end on because it's, you know, something that we talked about prior to the town hall. And I think it's been on a lot of people's minds. You know, how do we have this discussion now with family members, with friends, with people that we care about, when there is a little bit more fear? Dr. Hart and then Dr. Phillips.
So I would just start. So when the pause happened, there were 6 cases of women 18 to 50, 6 cases. During the pause, they found 10 more, 16 out of 7 million. And it, you know, there were serious side effects, but the reason that they did the pause more than concerned about the safety was to educate doctors about when you see this person comes in and they just had the vaccine within like a week period of time, this is what you want to do and this is what you don't want to do. Because usually when doctors hear a clot, we give heparin, and that is what you don't want to do. So part of it was to educate the providers. Part of it was to educate the public. So if you just got a Johnson & Johnson shot, you would know what to look out for. So part of the pause was for education, not for safety. Because you know what causes clots? COVID-19. That is a huge problem with COVID-19. So while this is a serious side effect, it is very few people impacted. Now, that doesn't mean that I don't think that those people who are impacted, you know, that I don't have empathy for them. But if you're thinking about the global community and our health, we need to be vaccinated. And as Dr. Phillips pointed out, we are dying at higher numbers. So it is very important for us to be vaccinated to take care of this, because, and I'm not usually cynical, but I remember when it came out that we were dying in higher numbers, then there was a lot of push to open the doors. Let's just get back, because people, oh, this not impacting me. Okay, so we have to take care of ourselves. And this vaccine is our way to stay healthy and not to have the serious consequences of COVID-19 infection and, God forbid, death. And I'll give the rest of the time to Dr. Phillips.
Well, again, you know, Dr. Hart said it right there. I think, you know, the chance of you getting COVID and then getting a clot from COVID is much greater than you getting a clot from getting the vaccine side effect. So I think it gave us all an opportunity to make sure that we get this message out appropriately, because not getting the message out appropriately has been the space where miscommunication has been able to explode. So again, I think that we wanted a circumstance where there was caution. You know, some of us do things in our own lives and don't check ourselves after 6 times of it happening. So, you know, I think, again, you know, the other thing is we've got to be as analyzing, as critiquing of our own selves as we've been about COVID and the vaccine, and so willing to be doubtful of it. You know, again, one of the things, as I said earlier, about COVID is that it unfortunately has exposed a lot of vulnerability on a national level, on a state level, on a city level, on a community level, and on an individual level. And again, mental health, spiritual health, physical health, it is all one continuum. And this pandemic has put us in a circumstance where we have, nobody can ask their grandmother or could say personally that they've been through something like this. This hasn't happened in 100 years. So again, I don't think that we should be so hard on ourselves if we have a moment. Like I said, I was man, I ain't messing with that vaccine person at a time. And then I educated myself. And now I'm out here advocating that people consider it. You know, I think that, again, we've got to use this tool, you know, for people out of God-fearing. And God put science there for a reason, you know, and I think that we've got to make sure, because if we don't get through the immediate, there ain't gonna be no long-term. And again, you know, I am seeing people, I'm on the admissions committee at the medical school. And just speaking of medical school admissions, I see how many students have been pushed off from applying to medical school because of what has happened with the pandemic. And they may not get back on the path. And that's just medical school. What about kids going to high school? You know, what about going from your freshman to your sophomore year in college? You know, again, Dr. Hart and I and any of the other people have the experience of enjoying being in a fraternity or sorority in college. That was part of our normal college experience. Those things are not happening anymore. And then people are saying, well, why do I need to get an education? You know, because they're seeing that, unfortunately, we're seeing with the doors opening back up, people being on Zoom working, and now they got to come to work. They're like, man, I ain't trying to go to work now. And it's not because it's unsafe. It's because of the luring of some of these negative qualities in us that have come to the top. And I think, again, you know, this leaning in that we need to do in our community is not just about COVID. It's not just about the vaccine. It's not just about, you know, whether you like to wear a mask or not. It's about what are the things that made us vulnerable in the first place? You know, what are the things that are making me and my significant other beef? As you know, or the fact that my kid looks at me every day like he hates me or something like that. All of these issues, again, that we are seeing magnified because you know what's happening? Chickens coming home to roost. You couldn't say in my family, hey, I have depression or I have anxiety. You'd be looked at like, what you talking about? You don't talk about that to other people. They don't tell you about the cousin that may have had schizophrenia. They don't do any of those things. So we never dealt with mental health. And it's not just African Americans, Hispanic, Latino, all communities have done it. And unfortunately, now the pandemic is putting that in the pressure cooker, you know, and the beautiful thing, and this is another point I'd say, engage telehealth technology. You know, I know at my office, we have counselors, we have psychiatrists, and they see patients via virtual visits. So you don't even have to come to the doctor. You know, again, you can use telehealth to get refills of your medication. You know, so again, we've got to be able to pivot with this because your blood pressure don't care about whether you're scared to go out the house to go get your medicine. Your anxiety or depression medication, they don't care about those conditions, do not care. That colonoscopy that you were supposed to follow up on because it was due, or that PSA that you were supposed to have repeated, or that A1C for your diabetes, those situations are not going anywhere and you can't avoid them. And unfortunately, we're seeing in the biggest example of all, our country neglecting certain populations, and they've created this big situation now that we are having difficulty getting the control over. So I think, again, as they've been saying, and I don't mean to say it to bite or to copy, we got to lean in, y'all. We got to lean in. You know, I think that's critical. That's what I would say.
Thank you so much, Dr. Phillips. And thank you so much, Dr. Hart. It has been wonderful having you with us this evening. So thank you on behalf of the URU team and our community for speaking with us. We are going to launch the last poll for our participants who are here in the Zoom with us. So if you could take a few minutes before you leave, I know we're a little bit over time, but I want to make sure I catch people before they head out. But again, thank you so much, Dr. Hart and Dr. Phillips. It has been wonderful talking with you this evening. I know that I learned a lot. I really always enjoy these town halls, and it's been absolutely phenomenal speaking with you both this evening. Thank you so much for bringing your wisdom and your insights to this conversation. We could not do what we do without you. Thank you. All right, so that last poll is still up. If people could finish up before they leave, that would be wonderful. And so thank you so much, everyone, for coming tonight on behalf of Crystal Emery and the URU team. We hope that this has been an enjoyable and helpful evening. We thank you so much for joining us, whether this was your first town hall or if you are one of our regulars. We appreciate you. As Dr. Phillips and Dr. Hart said, you are now COVID ambassadors in a sense, and we hope that you take this with you as you go. As always, we're humbled to be a servant to our community. Please be on the lookout for town hall schedule updates, and don't forget to check out our website, urutherighttobe.org, and our social media for more information on COVID-19 and risk prevention. I hope that everyone has a wonderful evening. Be sure to send in those polls, and with that, I wish you all a great night. Namaskar. Thank you.
Thank you, Dr. Hart. It was a pleasure presenting with you. Great information. Thank you so much.
Same here. Thank you so much. I'm looking forward to meeting you in person one day.
Absolutely. All right. I look forward to that as well. We're going to try to make that 4% a higher number. That's what I'm working on. So let's do that.
Let's do it. Thank you, Carmen. Thank you, Michael. I really appreciate it.
Of course.
Thank you. Thank you.
Thank you to the tech people. Thank you, Carmen. You were an incredible moderator.
Thank you so much. Yes, thank you to our tech team. Thank you, Ruth, Molly, Andres, Who else do we have with us? Eric. Is that everyone? Meredith. We have so many awesome people working behind the scenes who help to make these town halls happen. So thank you guys so much as well.
Thank you.
Brother Briscoe, I look forward to when we meet in person 2013, all right?
I'm
Rudy
looking,
Root.
I'm looking forward to it too.
All right, my brother. God bless.
Root.
Root.
And when someone else instead of